Hello, my name is Dr. Szilard Voros. I'm a physician, I'm the founder and the Chief Executive Officer of G3Therapeutics. We started G3Therapeutics about 7 years ago with a very ambitious goal to use biological big data like genetics to come up with new drugs and new diagnostic tests. We have been working feverishly around the clock for 7 years, and we have already identified new drugs for cardiovascular disease, for heart disease, for metabolic diseases, for diabetes, for fatty liver disease. And of course, right now, we're in the midst of an incredible crisis. Unexpectedly, since December, we have had this pandemic of the coronavirus. And of course, now I'm working with my team around the clock to figure out ways to identify the disease, to identify ways to treat the disease. We have some incredible opportunities and incredible insights, and although we are in the midst of an incredible crisis with enormous implications for public health, we have opportunities to actually treat this very, very dangerous virus. And my team is working on this. When the virus attacks the human body, the virus has to get inside the human cells. And out of the 20,000 proteins that we have in our bodies, we know there are 2 proteins that are super important for the virus to get in. And so we are now working with my team, finding ways how we can modify this protein in the human body, and we would be able to prevent the entry of the virus into the cell. If we are successful, we are able to identify people who may not even get the infection. And then if we're successful, we may be able to identify some new drugs that actually shut down the entry of the virus into the cell. So we all have to work together around the clock to tackle this incredible problem.